Hello, everyone. We're just going to give a few more seconds for more people to hop on, and we'll get started shortly. All right, I'm going to go ahead and get started. Hello, Partnering for Vaccine Equity Learning community members and others working on vaccine equity. Welcome to this afternoon's learning event. My name is Luis Gallardo, and I'm the website community manager for Group Learning. And on behalf of our team at the Urban Institute, thank you for joining us. At today's event, we will learn how to customize template resources that are rigorously translated, culturally relevant, and professionally designed to create your own campaign partnership with your local communities. We will also learn translation strategies that ensure materials are linguistically and culturally appropriate and meet the needs of refugee, immigrant, migrant, and other communities we may work with. But before we go any further, I'll do our typical quick review of how this session will work. Next slide. First, you've all been muted upon entry to this session. There are a lot of us, so staying on mute unless you are speaking is key to keeping the discussion going without accidental interruptions. You do have the opportunity to speak your question rather than type it into the Q&A. If you want to speak your question, use the raise your hand feature and we'll unmute you. If you want to type your question, use the Q&A tab to do this. And please note that you can type a question at any point during the session, or please feel free to let us know if you need us to slow down. The chat room feature is also open today, and we encourage you to chat amongst yourselves as you'd like. But please use good chat room etiquette. By this, I mean, do not post questions for the speaker in the chat because we might not see them there. And although this probably goes without saying, please be civil to one another and to our speaker while chatting. We are offering live interpretation from English to Spanish for this event. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. And finally, as with all our learning events, we will post the slides and a recording of this event on our community website and circulate them in the digests that go out through the CDC-managed Adult Vax Program listserv, which all program members should be a part of. And if you have any technical difficulties at any point during this session, please send an email to our community manager's inbox, vaxequitylearning@urban.org. We'll be monitoring the inbox and we'll try to help you as quickly as we can. And now it is my pleasure to introduce our featured speaker. Next slide. Our speaker today is Sarita Wilkins. Sarita is a communication strategist for the National Resource Center for Refugees, Immigrants, and Migrants, otherwise known as NRC-RIM, where she leads the communications efforts for the center, as well as guides the creation and dissemination of health communications materials. She has more than a decade of experience in strategic communications, specializing in internal communications, electronic media, and diverse and multilingual communities. Before joining the team at NRC-RIM, she led communications for K-12 public schools, most recently focusing on crisis communications and other efforts related to her school district's COVID-19 response. Sarita holds a bachelor's degree from Macalester College and a master's degree in linguistics from New York University, where she explored socioeconomic influences on Spanish-speaking immigrant speech patterns. Thank you, Sarita, for taking time to speak with us this afternoon. I'll hand things off to you now.
Thank you so much. So as Luis mentioned, my name is Sarita Wilkins, and I'm the communication strategist for NRC-RIM. And I'm going to start out today giving you a quick background about NRC-RIM, and then I'll go over some of our vaccine resources, and then I'll demonstrate how easy it is to customize our vaccine campaign materials. So NRC-RIM is funded by the CDC and housed at the University of Minnesota. And we exist to support health departments and community organizations working with refugee, immigrant, and migrant communities that have been disproportionately affected by COVID-19. And we do that by strengthening partnerships between health departments and communities, and by supporting the organizations that work directly with refugees, immigrants, and migrants. We support organizations by collecting and disseminating best practices, offering health communications and health education, and by offering online training such as this. We also offer technical assistance and a few other services. So I'll give you a quick overview of our vaccine resources that we offer that support COVID-19 vaccine work in local communities. We have a section of our website called Vaccine Central, which has resources to support vaccine planning, roll out knowledge and confidence among refugees, immigrants, and migrants. And so that would include checklists and guides, as well as promising practices from around the country that you can replicate in your communities. We have a translated materials library that has more than 7,000 materials in more than 175 languages. And so these are materials that are not created by us. They're curated from public health departments and other agencies across the country. And you can filter by topic, language, and resource type. So in addition to vaccine resources, there's also information about testing, contact tracing, and other preventative measures. And there's printed materials, audio, video, websites, and other interactive features. And all of these are free to use and distribute. We also have a collection of videos that are ready for you to use. We have educational videos about COVID-19, videos that raise awareness of the impact that the pandemic has had on immigrant communities, and videos that advocate for vaccines in multiple languages. We also have a video booth service where we can guide you through the planning process, help you write a distribution plan, and even assist with recording your video using virtual tools. So now I will show you our process for creating culturally and linguistically relevant materials. The first thing we recommend is doing some research. A common way to do this might be hosting a listening session. And for that, we recommend that governments partner with community-based organizations on that strategy. So listening sessions can be held either remotely through Zoom or Facebook Live, or in person while socially distanced. And the most important thing to remember when doing something like this is that listening sessions are for listening and not for trying to convince somebody to get the vaccine. And the reason we recommend this is that by listening to the community that you'd like to serve, you can learn not only about the topics that are of most interest or concern to them, but also the format that will work best. For example, if a community you're trying to reach is concerned about vaccines for children, but not vaccines for the elderly, you can create your communications and education materials around that point. If your community relies on a more oral tradition, you might put more of your resources and budget towards creating audio and video materials than creating written materials like fact sheets. Or if your community, you might find out that your community trusts information that's coming from their school or their child's school or their church. And then that way you can plan to distribute the materials you create accordingly. And so on the screen here, you see this is an advertisement from the Afghan Health Initiative out in Seattle, and they partnered with the health department to hold a listening session on Facebook Live. And so they had Dari and Pashto interpreters, and they kept the registration to 15 people to make sure they could have a good discussion. So the next thing that we go towards is creating the materials. And so we definitely recommend leaning on your partners or the results of your listening session to guide your work. So at NRC RIM, we work with the International Rescue Committee, which is a refugee resettlement agency, as well as the Migrant Clinicians Network and others, to identify emerging issues and that will require communication. And we work with them to sort of get insight on the themes and approaches that are going to be most effective. So our team then reviews and analyzes guidelines and communications that were developed by the CDC, and we convert that into simple, memorable language that's as easy as possible to translate. And then through all that, we're framing the communication around the questions and concerns that we're hearing from our partners that are working directly with refugee and immigrant communities. We also have a couple physicians on our team that we ask to review the final product before it's translated, just to make sure that it continues to adhere to the most current guidelines and is medically accurate. At this point, we send our content to a designer, which is usually either me or somebody that we have on contract. And they put together a fact sheet, a flyer, social media assets, or some other resource. But if you don't have the budget for a professional designer, there are tools that you can use to create your own materials. The ones I have here on the screen are Piktochart, Animoto, and Canva. And these are a lot of times free to use or low cost, and you don't need any special software. They have lots of drag and drop templates that can help you create something that's really visually appealing. Now, We've been told over and over again in our conversations with our partners that we should use photos rather than illustrations. People don't like cartoons. And so the most important thing I want to stress about choosing stock photos representing refugees, immigrants, and migrants is to portray them as active in their families and community. So I like to choose photos where people are doing something rather than just looking at the camera. We have photos of people shopping, reading, going to work, taking care of their children, and other routine activities. And we choose royalty-free stock photos. I didn't pay for any of these photos. And we choose those that feature people with diverse bodies, skin tones, and cultural markers like clothing or food. And I put on the screen here, and we'll send out after this presentation lists of websites where you can get some stock photos like this. So the reason why we create this, we have like a diverse set of images, is that we translate our materials in more than 40 languages, and there aren't enough stock images in the world to accurately represent all of these linguistic communities. And so that's why we also choose photos that are partially or fully obscured, or that incorporate design elements like dark gradients that might obscure the skin tone and the coloring of a person. And this way, people from many different backgrounds can see themselves reflected in the image. Interestingly, I'll go back just one. The photo on the far left of the woman helping her daughter with a mask, that is a photo that we heard from people in Latino communities, Filipino, Russian, people from all over the world really identified with this photo. And it's so interesting for me to, with that blue gradient over it, to see how many different people could sort of see themselves in that image. Interestingly, we heard from some communities that some communities do want to see themselves reflected in the photos, obviously, and others told us that when they see people that look like them in the photo, they think that their communities are being blamed for COVID-19 outbreaks. They don't want to see that at all. And so we had to be very careful with how we handled this. And so that's why we have photo options here that don't have any faces at all. It shows things that people used to enjoy before the pandemic, like traveling or sharing a meal. So once we have the design ready to go, it's time to translate. And we contract with a company called Inco International. We were very lucky to find them. And they provide professional translation services using a 3-step process, which goes above and beyond industry standards. You know, we don't send something to a translation company, expect to get it back the next day and then just post it. We work with Inco on this very rigorous process that we create. So for most languages, the translation is completed by a professional translator. It's proofread by a second translator and reviewed by a linguist. But for more rare languages, sometimes they may use a 2-person team rather than a 3-person team, but that's generally their process. And because Inco is such a high quality contractor, we know that when we work with them, that each translator and linguist is going to be fluent in the target language of the translation and resides in that community. So that ensures that they have an in-depth understanding of our audience. Their language team works together to determine the message of a text prior to translating. And so they don't translate anything literally, they translate the message, not necessarily the words. And when there's difficult texts, like something that's less literal, maybe medical words, things like that, they really collaborate with one another and their project manager to figure out the best maybe alternate phrasing or some other strategy so that the translation will be as effective as possible. Now, once the translators do their thing, they give it to us and we send it to another level of community review. And so we chose a community member, someone from the community who's fluent in the English and the community's language. And this person may or may not have formal language training. And so they help us flag any issues with the translation. We ask them, would a normal everyday person be able to understand what is being presented here? And so we ask our reviewers to catch issues like offensive language or sections that don't make sense or something where the message has been significantly changed, any areas where the reader might not understand the intended message because of complex language or some other issue. We ask them to also identify whether or not the translation and the photos that we choose are culturally appropriate. So if you remember, couple slides ago, I said some communities don't want to see stock images that look like them. This is the area where we catch something like that. You know, our community reviewer might come back and say, this is not an appropriate photo, and we know to change the design. And so we give our community reviewers a form to fill out that asks if the translation is accurate, if it uses the right tone, maybe too formal, maybe too casual, and if it's culturally appropriate. And they also have the option to add comments or suggest changes. And I probably don't need to stress this fact for this group, but we do pay our community reviewers for offering their expertise. Compensation is very important when partnering with community members on this kind of work. So the linguist then looks at the community reviewer's feedback and makes a decision on what the final language should be. We get the confirmation from the linguist. It comes back to me. I incorporate any design changes that need to happen. And then we convert it into customizable options, customizable templates, which I'll show you shortly. It's important to us to offer these customizable options because even though we try to be as thoughtful as possible, for example, with the photo selection, we want to offer organizations like yours the opportunity to do what's best for your own local community, and that might mean something different. So to summarize these steps, first, you need to listen and learn from your community so you know what topics, what media and distribution channels will be most effective. Then you create your materials, leaning on your partners, trusted resources like the CDC, and simple language. Design your materials using free tools or a professional designer, and choose photo options that will resonate with your audience. Your translations need to be rigorous and incorporate a community review to ensure that they're both accurate and culturally relevant. And then we finalize our designs with the advice of both a linguist and a designer. I'm going to pause there before I move on to the campaigns to see if, Luis, are there any questions that need to be addressed before I move on?
Yeah, there's a quick one that I know might have touched on this earlier when you were talking about, the difference between photos and using drawings. But someone asked if there's a preference for photos versus drawings / clip art / cartoons.
What we've heard from our partners is that people much prefer photos. And so it's interesting because I know that drawings, it can be easier to, change them for different communities, changing skin tones, adding hijab, or like some other format. And that's why we use photos, but we also use strategies like including a dark gradient, cropping, certain kind of cropping that we do so that even though it's a photo, it can be used with multiple communities.
Great. And then another just quick clarifying question. Yeah. Someone also asked if you could, and we could also do this during the Q&A at the end, if you could maybe type out the translation company that you use in the chat. Someone just couldn't get the name.
Okay, I will. I also know that somebody from that company is on this webinar, so feel free to drop in your web address in the chat. So I'm going to move forward with the vaccine campaigns. I know it sounds like everything that I just said sounds like it's a lot of work, and trust me, it is a lot of work, which is why we've taken care of a lot of that for you. So I'm going to demonstrate these campaigns for you in a second, but first I'm just going to go over what we have been able to put together. And before I do, I just want to make sure you know everything I'm about to show you is totally free for you to use and distribute without attribution. We care a lot more about getting vaccines in arms than we do about getting credit for things. So if you need to take off our logo, if you need to do whatever, that is totally fine. So our first campaign is Get Vaccinated, and that is based on feedback that indicates people from many different backgrounds connect with the theme of protecting their communities. And the goal here is to create awareness of COVID-19 vaccines and the impact they have on the collective group. This campaign includes posters and social media assets, which are currently available in more than 40 languages. And they're also customizable. So if you want to remove our logo, change the URL, or use a more culturally affirming photo, we have templates available for you to do just that. And this is an example of a poster we have. It's in Spanish. It says, protect yourself, protect your community, get vaccinated. This is a sample of some of our social media assets associated with the campaign. And we received some feedback that not everyone likes this dark blue branding there on the left. So we created a second version of these materials with a different look. We kind of casually call this the Band-Aid campaign. And so you can also, we have templates for you to customize the Band-Aid campaign. We have photo options that celebrate different people with different skin tones, body shapes, and with different identifying markers like freckles, tattoos, and scars. Something we launched more recently as part of this campaign is messaging about COVID-19 decisions being private. And so here we're taking a cue from public health messaging campaigns that we've seen about HIV testing that emphasize confidentiality. And this is because we know that in some communities, people are interested in getting the vaccine, but they are reluctant to do it because of social or political pressure. And so we want to make sure that these people know that there are options for getting their healthcare needs met while honoring cultural expectations. Somebody can get their vaccine, only they and their doctor will know, and they can still do their weekly testing as part of what they do for their employer. They don't need to tell anyone, they can keep going as they are. And so these are currently available in English, Russian, and Ukrainian, and we're working on translations in Congolese, Swahili, and Spanish, and then we'll add more languages after that. Our next campaign is called Get the Facts, and that is based on CDC guidance, offering facts about COVID-19 vaccines in a simple and memorable way that counters common misconceptions. So these facts address costs, ingredients, side effects, eligibility, and more. And these are also available in 40 languages. And just like Get Vaccinated, they come with drag and drop templates for you to add your logo, swap the photo, and do some minor editing. This campaign includes social media assets, we have fact sheets, and even we have audio and video PSAs for people who don't read in the language that they speak, or for those who may rely on a more oral tradition. We release new fact sheets from time to time that address emerging issues. We recently added fact sheets on testing, immigration, and employer mandates. Here's a list of all the languages we currently use for our campaign materials. So we include more commonly translated languages like Spanish and Arabic, as well as indigenous Central American languages like Popti and Mixteco. And we've seen a lot of downloads of materials in like Kinyarwanda, Haitian Creole, Pashto, and Russian. Our final campaign is called Vaccination Is. And so this is a little different. It was created using a community-led hyperlocal communication strategy that was developed by and for members of narrowly defined local communities. So with this campaign, we partnered with IDEO.org, which is a nonprofit design firm, to work directly with community leaders to co-create and disseminate messaging campaigns in support of vaccine confidence. And we did this because we know that unique communities need unique approaches to vaccine confidence that honor their priorities and the values and expertise of community leaders. So these are not being translated into 40 languages because the messages are not universal. They're hyper-local and customized to each community's needs. So the slogan, Vaccination Is, it kind of acts as an invitation, getting us all to think about what vaccination might mean for our communities and demonstrating that there's not one answer that's all-encompassing. For some people, vaccination is hope. For others, it's strength, and for others, it might be a new life. And it's only through a rigorous community engagement process that you can really know what will resonate. Now, we have ready to download campaigns that support the Iraqi, Latino, Haitian, Congolese, Afghan, Somali, Bhutanese, and Ukrainian communities. Forgive my dog if you can hear him barking. And it's interesting because like we have materials in Arabic, but you know what makes sense to the Iraqi community that we engaged with in Dallas versus an Egyptian community in New York might be different. And so we really tried to customize them based on what we were hearing from community leaders. We also created something called Makespace, which is a tool for public health professionals and community organizations to make their own customized vaccine campaign using in partnership with their local communities. And so with this guide, anyone can learn how to plan, create, and validate their campaign using the same community engagement process that we used for Vaccination Is. So Get Vaccinated and Get the Facts campaigns are effective if you want to do broadcast messaging that is universal and at a large scale. But for a more targeted campaign, it's important to partner with the communities themselves to learn what will work best. And we think that with our tools, you can easily conduct a mass communications campaign for your broader community, as well as develop targeted messaging for those who are hardest to reach, because both of these approaches are important for any vaccine campaign strategy. I'm going to pause to see if there's anything else I can answer quickly before I go to the demonstration.
Yeah, one quick question, just in terms of language availability for some resources. Someone was asking about Tibetan translated materials. And for any language that NRC might not have, do you have any recommendations for how one could go by translating those materials in respective languages?
Oh, goodness. Okay, so we don't have Tibetan. Our availability of languages that we offer, it is in part based on whether we can find a community reviewer that can check it for us. And so we do more than 40 languages. I think we're up to 45 now, and we're proud of that, but we can't do all of them just because of the 4-step process that we go through. And with regards to, if you have a language, if you want to do it in a language that we don't offer, I guess I would just say to look for a company that understands, both accuracy and cultural competency in their translation process, and that will offer like proofreading as part of the services that they offer. And then also doing that community review. And after this presentation, as part of the follow-up materials, I have links. We have some guides on our website that's how to choose a translation company, or how to plan for community review process, that sort of thing. And so you'll all get links to that after this. Anything else?
No, I think we can move forward.
Okay. Are you still able to see my screen?
Yes.
The website?
Yes, the website's up.
Okay, so this is our website. Our vaccine stuff is all under this, this portion here. I'll show you, this is our Get Vaccinated campaign. And so we have the posters. These are all the languages we offer, and this is the customizable version. These are confidential posters for you to download different versions in different languages. And we also, if you'll note, we kind of have here, how do you use posters effectively? So like I printed off this poster, now what do I do with it? We have suggestions there. We have a social media series also in all these different languages and the confidential messaging. And then we have tips here for how to use social media assets on Facebook, Instagram, and WhatsApp. We have this is kind of fun. We have a custom Facebook frame in all of these 45 languages. So you can search, if you search NRC Rem on the Facebook frame section, you can actually add it. I have this on my profile in Corinne. And then we have, some people use this as a Facebook profile photo, and some people have actually downloaded it and used it as a sticker for some of their vaccine events. And so we have this in all of our languages as well. This is our Get the Facts campaign. And so we have our social media series here. We have a one-page fact sheet, 2-page fact sheet, what to do after you're vaccinated. We have one on the Delta variant. We also have one on Omicron, which I don't have handy to show you, but we do have it on our site. Vaccines for children, breakthrough infections, why it's still important to wear a mask, fertility and parenthood, flu season, booster shots, and COVID-19 testing. And so I'll just show you really quick. I'll go to our short fact sheet, and I will pick, I'll do the one in, let's do Somali. So you click on it there to download the PDF. Download that now. But if you click on it down here, then it's going to open up like a presentation. And it gives you a little preview. And then you click Use Template. My computer's tired, so it's taking a minute to load. So here you have, this is our one-page fact sheet. You have instructions here on the sides that kind of tells you how to customize it. And then you can actually, I'm stopping my video for a second just because my computer's freezing. So you can just drag and drop if you want to take off our logo. You can change the URL here. We link to the CDC, but you could put whatever you want. And then if you don't like this photo, you can just click it, press delete. And we have a photo bank here of all these different photos that are pre-sized and ready to go. So I'm just going to click this one. I'm going to do copy, paste. I'm going to drag it up here. It's sized perfectly, so you just grab it by the corner. I'm going to right click, send to back, and there you have here a customized template that you can download. What we don't allow you to do is edit this. And that's because we go through such a rigorous community engagement, translation process that involves community review, and it's based on CDC guidelines. We don't allow people to change this content, but any part of the design you want to swap out the photo, add your own logo, you're welcome to do that. There's a similar template at the end of this document. So again, you can change our logo, you can delete this photo if you want to put maybe this one here. You can Control C, Control V, and then use size to fit. Right click, order, send to back. So that's how you customize these templates. This is the Vaccination Is campaign that I just had mentioned. You can see, you can jump to the different materials that we have in the different languages in support of various communities here. Some of them have posters, some have social media, some of them have stickers, some have video. It just kind of depends on what we heard from our community leaders in terms of what they needed. And if you want to do this kind of thing for yourself using a very rigorous community engagement process, you can click here, try Makespace. And this will open up, this is our tool that we have that kind of guides you through that process with your community leaders. We have things like checklists, things like how do you identify a community partner, things like that that can really help you sort of go through that same process there. So that's it for our campaigns. Right now, I'm going to talk about how to, I know that things are happening really fast right now and that CDC guidelines are changing all the time, so I can offer some strategies for how to deal with that. So writing tips, number one, we recommend sticking to broad languages related to the different guidelines that are released. And so this is an excerpt from our fact sheet on wearing a mask. We don't get into the details about whether you live in a high transmission area, whether you're vaccinated or not, whether your city has a mask requirement, whether you're inside, whether you're outside, how many households you're around, any of that. The bottom line message is that it's safest to wear a mask in all circumstances. And so that's the number one thing that we want people to remember. And that's something that can be applied across the country in every community. And it's also unlikely to change as the pandemic evolves. For design tips, we have a fact sheet on boosters and another one on vaccines for children. And the only place in these fact sheets where we mention the age is in the top right corner. It's that red dot. And we did that because as guidelines change, you can easily, say you printed 200 of these, you can cut off the corner, you could put a sticker over it. You can do whatever you need to do to keep using these materials, but also we have these red dots pre-translated for 5+, 12+, 16+, and 18+ in all of our languages. And so we can quickly swap things out. When they changed the vaccines for children age from 12 to 15, we were just in a couple days able to update all of our materials because we use strategies like this. Now, the process for creating a new fact sheet, like when we decide, okay, we're going to do one on Omicron or we're going to do one on boosters, whatever it is, it usually takes about a month for common languages like Spanish, French, and Arabic, because we go through this whole process with simple language, CDC guidelines, community review, and translations. And that leaves a huge gap in time where communities don't have the information that they need. And so this is why we always release conversation guides first. And we're counting on bilingual community leaders and staff at like refugee resettlement agencies or other community-based organizations to answer questions from their clients with these resources. And that's to say that, we know that dispelling myths and alleviating apprehensions around vaccination requires a trusted relationship in a safe, non-judgmental environment. So that's environment that already exists in a lot of community service organizations. And so our conversation guides equip readers with the skills that they need to answer questions about vaccines confidently and participate in conversations with others, ultimately supporting vaccine confidence in their communities. We create these guides as new issues emerge. We monitor news reports, as well as engage with our partners at refugee resettlement agencies and other organizations to understand what the common questions and concerns are around or among refugees, immigrants, and migrants. So this is a list of our topics that we have right now. And this is just kind of a comparison. And so we have our fact sheets, we have our social media, we have our video PSAs. The audience there is communities. These are translated. We try to make them as evergreen as possible and use general statements. But our conversation guides, they live on our website. They're only in English. They're updated regularly. And they include very specific guidance that's accurate for the moment. So that is all I have. I will take any and all questions.
I can go through some of the ones that came in this last section. Some of them were regarding the Makespace, the redesign template that you showed us. Someone asked if you could use your own photos or if you could import your own photos from like your drive.
That is a great question. And the answer is it depends on the resource. So there are, like for something like Vaccination Is, I think a lot of times you might need to crop them to fit the heart shape and things like that. But if you have a little bit of design background, you absolutely could. For the things like our Get the Facts campaign, because we have this gradient overlay, that's a little bit harder to do. But there's some fact sheets like this, our long fact sheet just has this rectangle. So you could put any rectangular shaped photo there. You don't have to use from our photo bank.
Great. And then staying on the design portion of the presentation, someone also asked if you could re-clarify who the nonprofit design firm that you worked with was.
So that was ideo.org. It's ideo.org. I can put it in the chat too.
Okay, great. And then while you're typing that, back to some of the language translation stuff that we were covering earlier in the presentation, someone said that they saw the Marshallese language in the list that you provided, and they were wondering if there were any other contacts within NRC RIM or any, I don't know if this would be the translation organizations, but who they could contact to get better representation from the Marshallese community.
Marshallese community, I would say email me and I'll put my email in the chat.
Okay, and kind of just working backwards here, because now we're going back to the first portion of the presentation where we were talking about, I believe this was the group review and the focus group. We had two questions about this process. Someone was asking about the timeline, which I assume just how long does it usually take? And then someone else was asking on any suggestions you have with how many people or how many community reviewers should be in this focus group.
So I need a clarifying question. And so in the very beginning, I talked about you need to listen to your community to inform the materials that you're creating. And there was Afghan Health Initiative did have a focus group for that. The community review process, that's part of the translation. I say community review, but it's one person, it's not a group. And so we budget, I think, a week or two for that community reviewer to go through the translation and make recommendations to the linguist at a translation company.
Okay, great. And this is just one question that I have that I'm curious about in terms of outreach to community members. How do you usually go by choosing, like how do you know what community members to contact, what leaders in the community to reach out to when it comes to doing these focus groups and community reviewers?
Yeah, that is a really good question. I would look to maybe a few different places, like either faith communities, religious organizations, for example. A lot of times we'll know who the influential people are in the communities if it isn't a faith leader, him or herself. And there's also like other community-based organizations. I would recommend just, setting up a networking phone call if you need to figure that out. It is having an established relationship is really important for this. And so it might take some time to build that relationship before you might ask to partner on an event like this. And but I guess I would just say, like, there might be other, if your community, like I know, and I'm based out of Minneapolis, and we have like Somali TV, we have certain newspapers and other media. You might notice like the same faces like community leaders mentioned there as well. So that's a few ways to sort of get started and who you might talk to. But generally speaking, building those relationships with the communities, with the community leaders and the community organizations is going to put you in the right direction.
Great, thank you. I mean, we've answered all the questions in the meantime, so while maybe people are still thinking, I'm curious also to know, how do you see this work like moving forward? I know you mentioned earlier, it's of course unpredictable, but I feel you did mention a little bit about, like specific priority populations that might have, and I mentioned like HIV as a, as a group of people, HIV positive people as a group that you've been able to use these materials for. So how do you see this moving forward and during the pandemic and after?
We were inspired by other like public health campaigns about HIV as we were creating some of our materials. We have not done work in that space specifically. We are funded by the CDC, and we are specifically funded to do COVID. And so we're just going to keep on pursuing that goal and doing what we can to help communities either get vaccinated, get access to testing, and do other preventative measures that they need. To be as safe as possible. So we're going to continue in that direction.
And then I know we had another question about, there was one slide that I think it read, if vaccinated, you're unlikely to be infected with COVID. Could you go through and describe again how you would decide when to change these discussion guides as CDC resources keep coming out and guidelines?
I know. So this came up recently where our fact sheet on breakthrough infections, there's a line in there that says breakthrough infections are uncommon. And what we talked a lot about whether we should update that. And we decided not to because of the translations and everything, but we did update our conversation guide to kind of strip that language out. It is still true that you're much more likely to catch COVID-19 and become seriously ill if you're not vaccinated. And so we ended up keeping it. We kind of debate with our team, including one of our physicians, Dr. Stoffer, to talk about like how medically important is it to update this language. And so it's just a collaborative discussion that we go through.
Great. And I know we have two questions in the chat, but I saw someone, I think Tracy, raised their hand, but I think they just put their hand down. So if you wanted to speak your question, feel free to raise your hand again and we can unmute you. But in the meantime, we do have another question asking if you have any messaging that has been effective in addressing hesitation of undocumented citizens to get vaccinated because of fear of deportation.
Oh, goodness. Yes. Yeah. So we have a few things. We have a whole guide on what we call immigration-based vaccine hesitancy. And so certain things like, for example, having a listening session with the community before a vaccine event, like before you even bring the vaccines in, perhaps bringing in an attorney from the community who can explain in language everything that is like basically that you can get vaccinated regardless of whether you're undocumented, like everyone is eligible for a vaccine, and it's not going to be public charge. It's not going to affect any kind of like your immigration status at all. And having somebody who's a trusted messenger kind of explain that to folks even before you bring vaccines in the picture to help get people comfortable. We've also recommended, like, if you're having a vaccine event and you want to make sure that it is sort of culturally relevant and culturally appropriate and as comfortable as possible for folks, having somebody from the community do a walkthrough with you and point out things. Like I have volunteered at vaccine clinics, and I know I've seen clinics where there might be a police officer at the entrance. It's like, okay, so if you had to do that, could that person be plain clothes? Like, are there other things that you could do? But we have just stated very plainly that you can get vaccinated regardless of your immigration status or whether you have health insurance or an ID. Yeah, I mean, and also sharing, I think people sometimes just need more information. Health data is private and confidential, and it's not shared with other agencies. This is something that public health officials are, that's just part of their job. It's confidentiality is super important, and people could get in a lot of trouble if they breach that confidentiality. It's in the best interests of our entire communities for everyone to be vaccinated, including undocumented people.
Great, thank you. And I think we've, again, got into all the questions, so we'll give people a few more seconds, but there was something asking, and I know I saw this question a couple of times, so I can just clarify, and then Sarita, feel free to jump in with additional clarification on how these materials will be distributed. But we will be sending out links that include all the websites that Sarita mentioned during the presentation. Someone was asking about finding the royalty-free stock photos, and I just want to make sure if that was in the in that flyer that you sent me with all the links.
Yeah, we do have links to the royalty stock photos in the list of resources you'll get after the fact. If the question about distribution is about how we are distributing our materials, we do a few different things. I mean, we have partners that are on the ground, like the International Rescue Committee, people that are hosting vaccine clinics in immigrant and refugee communities that are bringing these fact sheets, that are doing these things. We've done a little bit of social media advertising, and we work primarily with health departments and community organizations, not directly with the communities themselves. We're kind of like one step removed. And so we want to make sure that they're well positioned to interact with, engage with, and communicate with their communities. And so we have like a partner, National Association of City and County Health Officials, those sorts of folks that we're working and talking to on a regular basis.
Great, thank you. And then this next question, which actually is something that we in the learning community, I feel like, are constantly working on as well, is how do you balance sharing essential information, but not overwhelming the community with all these great resources?
That is a great question. One strategy that I've used is kind of asking permission a little bit. Like if somebody says that, they think that, or they've heard that the vaccine might make you infertile, for you to, instead of being like, well, here's this fact sheet and here's this thing and here's this research and here's this paper, being like, okay, tell me what you know about that. Are you interested in hearing what I know about that? And kind of approaching the conversation very gradually and doing consent checking along the way, like as you're having conversations with people. But yeah, it's an overwhelming amount of information for all communities. And, immigrant and refugee communities, it's no exception. There's a lot of information out there.
Thank you. And we had a few more questions come in. Yeah. So I'll get to the next one. Was asking specifically for people with access to Spanish media, if you have any resources or advice for promoting materials around vaccines among harder reach communities who, again, might not be engaged with CPOs in a place with minimal Spanish media.
So we do have a guide to working with traditional media on our website, if that was the question. But some things you could do is partnering with schools and employers. A lot of, if you're talking like maybe a rural community, something like that, there's often like a few big employers that may count immigrants and refugees among their workers. Like I said, partnering with schools, both as trusted messengers, as well as a means to like host a vaccine clinic potentially. We actually, one of our partners out in Texas did what they call a block walk, where they were literally like walking down the street and knocking on doors and talking to people about this stuff. And so there's, not everyone's on social media, not everyone's going to events hosted by a CBO, but a lot of people are working, a lot of people go to school, and just kind of getting to know the neighborhoods where you're trying to reach out to people is gonna be super helpful.
Great, thank you. And then another question is asking if there is a resource specific to people who hesitate to get their children vaccinated, even though they themselves might have chosen vaccination.
Yeah, so we do have a fact sheet on vaccines for children, and actually we have a whole section on our website on vaccines for children that has all of our resources, conversation guides and fact sheets and social media and everything that we have. But what I have heard is that parents who get vaccinated but don't want to vaccinate their children, a lot of what their concerns are long-term side effects of the vaccine. And I think that it is okay, when you're talking to folks, to say like honor that. It's like, you're right, the vaccines haven't been around very long, and I can understand why that would be scary to you. But the truth is that children are much more likely to have severe complications from a COVID-19 infection than they are from a vaccine. And I think that is a message. Like, people think that, oh, kids don't get very sick, so they don't need it, kind of thing. But the truth is that there's some kids that do get really sick, and we don't yet fully understand long COVID and the fact that they might not be very sick when they get COVID, but they might a few months later develop asthma or something else. And so pointing out the long-term side effects of an infection is going to be, I think, an effective message. Another thing that that I've heard people are concerned about are like fertility or puberty, like it affecting like their kids, like a teen. And the answer is that the vaccine doesn't affect puberty or fertility, and we do have fact sheets on that in all of our languages if there's interest. Really, we try to focus on, in terms of like fertility and parenthood is the name of the fact sheet, and it's really like helping people understand that getting the vaccine and getting your kid the vaccine is like the best way that you could protect them and continue to provide for your family. And ensure that your children are healthy into the future and can have families of their own someday.
Thank you for that answer. I'll give it a few more seconds. We already went through the questions again. You're just really good at it, Sarita.
Very efficient.
We have another one. So
okay,
there.
Great. I love this game. Yeah,
no, this is great. Do you have any tips on campaign evaluation for making sure that these campaigns or these partnerships are actually being effective?
So we track, for example, clicks, downloads from our website. We do website traffic. We do all of our social media analytics. We could track that. We have not done this, but one thing you could do is, if you're posting like a poster or something like in a neighborhood, going around handing out flyers, like what would a typical, say, ad buy in that neighborhood be? Like if you wanted to put something on the side of a bus shelter, like what would that cost? And you could say like these efforts were the equivalent to like this amount of money in paid marketing communications. You could do some surveys and focus groups on your materials. You might want to compare, like if you're using our materials, compare ours with like the CDC's with like a local health department, ask folks which they like better, which they trust more. Things like that could give you a little bit more information. Unfortunately, I don't think it's really possible to say like 40 people got vaccinated because of this fact sheet or because of this campaign, because there's so much that goes into somebody's decision. By the time they see your fact sheet, they may have talked to their child's teacher. They may have gotten the mandate from their employer. They might be like on the fence, and like this is the one thing that pushed them over the fence to get vaccinated, and that's great. But to say that this is like, individually the reason why they got vaccinated, I'm not sure that I would be able to like draw that conclusion for sure. But I do think there's other ways, surveys, focus groups, that you could sort of approximate the effectiveness of a campaign.
Great, thank you. I'll go ahead and give it a few more seconds to see if anyone has any other questions. We are approaching 3, so we probably have time for like 1 or 2 more. But if there aren't any questions, we can move forward. I'll just give it a few seconds.
The slides and a list of resources. If you were frantically like trying to write down URLs as I was talking, don't worry, because that's all you're just gonna get it all in your email and the slides and the recording. So don't fret. I love sharing. Don't worry about that. And Alyssa, I appreciate your kind words. I can see here. Share my screen again.
Another question while you're doing that just came in. People are also asking for tips dealing with communities that have low literacy.
Yeah, so that's super important. And that is why we offer, we have audio and video PSAs, specifically because not everyone reads in the language that they speak. And some people who even do read in the language they speak, they just, like I said, they rely on an oral tradition, and they just might be used to storytelling as a key part of their culture, for example. And that's why we create these videos and these PSAs. And you can definitely download them, reuse them. If you need a file format that's on our website, just let us know. We're happy to provide that to you. And also sending, like, I think WhatsApp is really important, especially among immigrant communities. And so that's kind of why that's our inspiration for putting the audio messages up, because people often will send audio messages on WhatsApp, like text it to each other. So those are the things that I would recommend for sure.
Great, thank you.
Mm-hmm.
I know you can pull it. I don't know if you were going to pull.
Yeah, I was going to pull it.
Oh, and another question that just came in. This will probably be the last one, and then we'll move on to the sides. But someone asked if they could work with you on a PSA in a language that you may not have, at least for the starting a campaign, or just working on a language, again, that isn't already in your language bank.
Yeah, so we're not a translation company, so we don't have the capacity to help people with that sort of thing. But if what you need is advice, like if you want me, I would be happy to, you have a script, you want me to look at it, like I'd be happy to take a glance at it and let you know what I think. But in terms of creating materials in languages that we don't currently offer, or like working with another organization that we don't have a formal partnership with to create a material, that's not something that we have the capacity to do, unfortunately.
All right, well, thank you very much, Sarita, for that insightful presentation and Q&A. We are coming to the end of our learning event. And just to reiterate everything that's already been mentioned, Sarita did forward me a document with all the relevant links that she covered today. And that document, along with English and Spanish recordings and the presentation slides from today, will be posted on our website, our Partnering for Vaccine Equity Learning Community, the partner listserv, and we'll also email it either today or tomorrow. 2 quick announcements before we all go. One, if you could all please take a few seconds to submit the satisfaction poll that will appear on your screens. It should be popping up now. And while you're all filling that out, I'll just briefly cover our upcoming events. So our next event is on January 27th, titled "What's Your Story? Creating Narratives to Support Public Health." And we'll actually have a few speakers from organizations in our learning community share their experiences in using storytelling to reduce vaccine hesitancy and increase vaccine equity. And we'll also have the executive producer of Grey's Anatomy speaking, and I'm definitely excited to learn how storytelling around public health is used in the entertainment industry today. And our next series of events will be our social media workshops, Tuesdays in February. Just as a note, these workshops are only available for our Partnering for Vaccine Equity Learning Community members, and we will be sending out more information on Friday, so tomorrow. Please keep an eye out for additional details and steps on how to register. And thank you all for taking time from your busy schedules to learn with us today. I appreciated listening to all of your questions and discussions, and I hope to see you all in future learning community events.